Hi, this is Dr. Sara Siddiqui, and I'm here on behalf of the Elwood Public Library to talk about this month's topic, which is COVID vaccines in children. And again, I would like to thank the Elwood Public Library for allowing me to come on and share with you some information. So again, I'm Dr. Sara Siddiqui, and I'm a pediatrician at the Huntington Medical Group, NYU Huntington Medical Group, and I specialize in pediatric and adolescent medicine. And I have no disclosures to identify. Of course, this is for informational purposes only. You do want to discuss any specific issues that you may have with your medical care provider, and thank you. And please feel free to ask me any questions. Please contact the Elwood Public Library if you need to get in touch with me. So COVID-19 is still, we're still experiencing a surge currently. It looks like we are at the stabilization point, at least in Suffolk County. For the past 2 to 3 days, we've been at around 20%, whereas last week we were at a 3 to 24% infection rate. So that means that every test that was done, 23 to 24% were positive. So that was the highest that we've seen recently, and now we're kind of dropping down. So we're hopeful that we're at the point where we're reaching a plateau, and hopefully we're going to see our cases drop. That's in our local area, but the rest of the state and the country, there are some areas that are still experiencing a surge. So, and the Omicron variant seems to be the most dominant. They do check random sampling of PCRs done in the testing centers to determine whether it's still a highly concerning variant that we're detecting. So specifically, we're going to be talking about COVID vaccinations in children. Recently, as you know, ages 5 to 11 were approved to be given and to be given, and there's 2 doses that are administered. It's by the Pfizer. It's manufactured by the Pfizer. It's the Pfizer vaccine, and it's 2 doses, 3 weeks apart. And we'll be discussing a little bit more about that. But I just wanted to let you know that pediatric hospitalizations have been on the rise, and we're seeing more pediatric cases of COVID testing positive in the office as well. So it is something that is happening in children. For the most part, it is still something that they do recover well from, but we still don't know the long-term effects, and we are worried about things like multi-inflammatory syndrome in children, which we will talk about a little bit. But December 5th to the 11th, 2021, and through the week of December 26th, we were seeing an increase in pediatric hospital admissions from 70 to 571 per week, and this was statewide, and this is very concerning. Pediatric admissions in New York City increased from 22 to 385, and Mid-Hudson and Long Island regions combined experienced an increase from 12 to 112 per week. And we have to remember that luckily in Suffolk County, we are very lucky that we do have tertiary care pediatric centers that can take care of pediatric hospital admissions, because we have pediatricians there and people that specifically care for children and can handle an increase like this. But there are some areas of New York State, for example, upstate or Westchester County, Dutchess County, where there aren't a specific pediatric hospital that may not be able to care for such a huge rise in pediatric admissions, and they may need to travel to the city or upstate or further upstate like Albany to get the care that they need. So it is concerning for pediatricians. The New York State Department of Health recent report also states that the New York State Department of Health reported an increase in pediatric COVID-19 hospitalizations, and new pediatric hospitalizations continue to increase statewide. So this was at the end of last week I got this data from, and you can go to the New York State Department of Health and they have this data available to you. And New York City, Mid-Hudson, Long Island regions have been increasing, but hopefully we're seeing a stabilization now that I checked yesterday. So that's some good news. I just want to go over some of the adult vaccination rate. This is also from New York State Department of Health and CDC. And as you can see, we're at the 95% 84% for 18 plus with at least one dose, and all New Yorkers with at least one dose were up to 85.2%. Thankfully, we are seeing some increases in the vaccination rates over the past 24 hours. 83% have completed both the series, and all New Yorkers completed the vaccine series at 72.4%. So currently there's ages 5 plus, so anybody with 5 and over may receive a vaccine. And for 5 to 11, it's 2 doses apart, 2 doses 3 weeks apart. And ages 5 to 11 is only 1/3 of the dosing of the 12 plus dose. So it's 10 micrograms versus the 12 plus dose is 30 micrograms. So it is believed that the 1/3 of the dose has reduced some of the side effects that we're seeing in some of the older children. And we are not seeing as much of the side effects. We are seeing some arm pain, fever, malaise, and body aches and pains. We are seeing some mild allergic responses too, and that's all part of your immune system being inflamed. And I will talk about that a little bit later. So according to the New York State Department of Health data for the week, for this week, the rates of vaccinations in ages 5 to 11 is still a little bit low. So Suffolk County is 13% of the total ages 5 to 11, and Nassau County is almost 24%. And we want to see those numbers a little bit higher because the more people we have vaccinated, the better will be for themselves and the community. We don't want to see an increase in pediatric cases in the hospital. Booster doses, so that's currently being recommended for ages 5 plus. If 5 months have passed since the second dose, immunocompromised patients may receive a booster sooner. So if you're immunocompromised, you're on medication, you have perhaps Crohn's disease, irritable bowel disease, you do want to speak to your physician and ask about a booster dose that can be given sooner, and it can be given 28 days after the second dose. So please speak to your doctor to find out if you may be eligible or your child may be eligible for that. So some of the questions I wanted to go through, and I know we've probably been through this a little bit before, and I do talk about this a lot, but these are some of the questions that I get, or some of the most commonly asked questions about the pediatric COVID vaccine. So why should my child be vaccinated? I've heard that it's mild, and I'm tired of talking about vaccinations. I do get that from my patients sometimes. And I understand, it's understandable that, we've been kind of talking about vaccines for a long time, but for the ages 5 to 11 and even the lower age group, 6 months to 4, that vaccine is still being studied, and hopefully we'll hear about that by about March or April. They did find the 2-dose series was not fully protective, so they didn't want to release it yet until they get the 6-month trials. They wanted to do a booster dose after 4 to 6 months, and then they're going to release that data, and then hopefully we'll see some approvals then. But 7.9 million children again tested positive since the onset of the pandemic, and the 21st week in a row, COVID-19 cases are over 100,000. And vaccines do prevent the spread. So children sometimes can spread the COVID-19 to other people in the home, elderly or immunocompromised people in the home. So being vaccinated will help prevent that. It will help prevent hospitalizations and severe disease. So I will show you a little bit of a graph of vaccinated versus unvaccinated patients in the hospital. And it'll prevent the spread among those that are vulnerable. Prevention of long haul COVID. So we are seeing not so much in the younger children, because it's been so recent that we've had such a high number of cases in the younger children that we haven't seen so much long COVID at this point. But what we are seeing in the adolescents is a persistent cough, the fatigue, and sometimes some little bit of memory loss or difficulty remembering things. So there is something that is called COVID fog that has been happening to the adolescents and some of the young adults. So is it safe? I do get this question quite a bit, and the answer that I give is that although it is a vaccine that's been recently approved, it has been well studied for over 2 decades. The mRNA technology has been around and studied for since the beginning of the SARS and MERS, the original coronaviruses in the early 2000s, and that's when they started to review the mRNA data, and that's when they were starting to see if that was a viable option. And so they were continually studying it. And then when the COVID-19 virus came about, they were able to review and update it to help with this virus. There is always safety data that's evaluated and prior to approval, and there are many steps that go on to approve a vaccine before it's put out into the public. Many trials that happen, and the rapidness of the release of the vaccine was not due to any shortcomings on the actual data. It was actually the financing and the way that they put it to the top of the line to make sure that it was approved. Once it got to that point where it was supposed to be approved, the meetings happened much quicker than some of the other vaccinations. And over 5 million children, this was by about November, early December, have been vaccinated ages 5 to 11, and we have not seen any serious side effects noted. And some of the side effects are, as I said, arm pain, redness, body aches, pains, and fever. My child has an allergy, can they still receive it? And if your child does have any specific food allergies or any type of allergies, of course, speak to your own physician and make sure. But we are recommending to make sure you have Benadryl. If you are prescribed an EpiPen, take that EpiPen to the vaccination site and keep it on hand and observe your child for 30 minutes post-vaccination instead of the routine 15 minutes. I found that this website, the cdc.gov, has a great little slide presentation too. So I didn't want to just take that over, but I wanted to give that to you so you can go and so if you wanted to just click on this, 10 things to know about the COVID vaccine in children, if you just go on cdc.gov and search it, you'll be able to find the information, and they go through a nice presentation as well. What about the risk of infertility? So unfortunately, this has been a lot of misinformation has been spread about the infertility risk in vaccinations. There are other vaccinations that have unfortunately had that alongside them, which is not associated with it. Specifically, there has been plenty of studies, and the American College of OBGYN, which is the obstetrics and gynecologists, have supported vaccinations, and they've supported it in pregnancy and lactation to protect newborns and pregnant women, because it is shown that having actual COVID during that time can be very dangerous for delivery, can cause preterm labor. And so it is not associated with any fertility risk. The mRNA vaccine does not cross into your own DNA, does not get into your own nucleus. It is well known that it just stays in the outside portion of your cell, and the actual component of the vaccine your body gets rid of after it makes the protein, the spike protein, and then your body builds an antibody to it. Your body gets rid of the actual mRNA that provided that map and remembers the immunity or the spike protein antibody that's developed. And my child has a heart murmur. Should they still receive the COVID vaccine? So as you know, the heart murmurs in children are very common. You do want to speak to your provider or perhaps get a cardiology consult to make sure. But the adolescent and adult COVID vaccine was reported to have a rare association of myocarditis, which is a slight inflammation of the heart. It's a much milder form than what's found when patients have actual COVID, and it is treated with Motrin or Tylenol. You do want to speak to your healthcare provider if you do have any chest pain post-vaccination, any vaccination. if you're having chest pain or your child is experiencing any pain in the chest, you do want to contact your doctor. But it is a very rare side effect, even in the 12 plus age group. In ages 5 to 11, we have not seen that side effect because the thinking is that the dose was much lower. But COVID infection and disease is also known to cause something called multi-inflammatory syndrome in children. And basically this happens 4 to 6 weeks after primary infection. It can be a mild infection that your child may have had, and it presents with a really high fever, vomiting, headaches, nausea, diarrhea sometimes, and it really is, they do get very sick. It does require hospitalization. We do know more about it now, so we can treat, and usually the treatment is IV infusion of IVIG, which kind of calms the immune system down. It is thought to be an immune response or a hyperimmune response, and it kind of like an autoimmune response that attacks your own body, and it's a much more severe form of myocarditis and pericarditis that can lead to hospitalization, and sometimes rarely can be fatal. So my child has already had COVID-19, so why should they still receive the vaccination? Yes, so natural immunity combined with vaccine immunity has been shown to have even better protection than natural immunity alone. There are reports that people that had COVID previously are getting COVID again. And so with the vaccination, that seems to have prevented that. And if a patient has received monoclonal antibodies or convalescent plasma, then they would need to wait 90 days before getting COVID vaccination. But if you've had COVID and it's been at least 2 weeks since you've been recovered, then you may get the vaccination at that point, or even the booster at that point. Again, you want to talk to your doctor regarding specific dates. So this is from the week of October to December, and you can see in New York City just cases of COVID-19 per 100,000 people, and you can clearly see that the vaccinated rates have stayed the same, but unvaccinated, there was a spike in December. And so, it is something that can keep you out of the hospital. Vaccination is something that can keep you out of the hospital, which is ultimately what they're for. Vaccines may not prevent it completely, but think of it as wearing a seatbelt when you enter a car. It's promoting health. It's making sure that you stay as safe as possible. Does it prevent a car accident when you wear a seatbelt? No, but it does keep you out of the hospital. And then vaccination can protect against multi-inflammatory syndrome in children. A new study released Friday in the Morbidity and Mortality Weekly Report found the Pfizer vaccine is 91% effective against MIS-C, and none of the MIS-C patients in the study who were vaccinated required any type of intensive care or hospitalization. So I just wanted to kind of end by saying that we're still seeing plenty of cases. Even though it looks like we're at a plateau, you still want to maintain some of the mitigation measures that we're continuing to recommend. So please continue to protect yourself by wearing a proper fitting mask. Consider upgrading to a surgical or the KN95 mask rather than the cloth mask right now. Ensuring a well-ventilated area. Make sure that if you're not feeling well or you're sick, just get tested. That's the best way to know. It looks like a cold. There's plenty of cases that I've seen that, I just thought I had allergies or I just have a runny nose, and it turns out to be COVID. So please just get tested so you're aware, you can protect your family and friends that may be around you. Get vaccinated and encourage others to get vaccinated. If you have any specific questions, please reach out to me. I'd be happy to discuss one-on-one what your concerns are. And again, follow quarantine and isolation guidance if you're exposed or test positive for COVID. The CDC has just adjusted their guidance, and it can seem a little bit confusing, but for the most part, most people do feel better at day 5 after they've been testing positive or symptomatic. So after the 5th day, if you do feel better, you can come out of isolation. And the quarantine measures also, if you're vaccinated and are asymptomatic, you don't need to quarantine if you've been exposed. So, but just reconfirm your specific situation with your doctor. We're always on hand to speak with you anytime you need. And thank you. Any questions, please contact the Elwood Public Library. I just want to thank them for allowing me to come on here every month. I enjoy it supremely. I hope that you guys do too. I hope that you're getting some benefit out of this, and that it's not something that that you find. I try to keep it short, and I try to make it just the pertinent things that I want to say about certain topics. And if there are any topics that you want me to cover, I'd be happy to do that. And again, these are some resources that I used. And thank you again. And email the reference desk if you have any concerns.